Hi, I'm Ryan Dutcher with North Country Communications. We help healthcare organizations operationalize HIPAA and other compliance requirements into practical, defensible workflows. This is our second video in our series on the recent Part 2 alignment with HIPAA. And today we are shifting from what the rule says to what your practice needs to do on Monday morning. Enforcement began on February 16, 2026, and OCR is already investigating complaints and breach notifications. Many practices are waiting for their EHR vendor to roll out integrated tools, and those tools are coming, but waiting for perfect technology is not compliance strategy.
I'm Rachel Seeger. The encouraging part is that aligning Part 2 with your HIPAA program doesn't require a major overhaul. Most practices already have the foundation. They just need a few updated forms, workflows, and a consistent way to document patient rights and consent. Let's walk through what this looks like in practice.
Start with the updated Notice of Privacy Practices. OCR has published model language that includes the new Part 2 requirements, how substance use disorder information can be used, how treatment payment healthcare operations work, and the patient's right to revoke consent. Operationally, this means updating your MPP everywhere it lives and training staff on how to explain the new sections.
Let's talk about the new TPO consent. Patients can now sign one consent that covers future TPO disclosures across the HIPAA ecosystem. This is a big improvement for both patients and staff. Practices should add this consent to their intake processes. Use plain language scripts to explain the change to patients and make it easy to sign, and ensure that revocations are documented and communicated across teams.
Even without EHR automation, you can build a workflow OCR will recognize as consistent and repeatable. Collect the updated MPP acknowledgement and TPO consent. Scan them the same day, index them correctly, and track which patients still need updated forms.
A few low-cost workflows we recommend. A Part 2 intake checklist, a simple Part 2 flag in the EHR, standardized scripts for explaining the new consent, a redisclosure decision tree, an updated business associate agreement that includes Part 2 obligations. These are small steps that will dramatically reduce your risk. Be sure to document your processes for updating your policies and procedures when you operationalize these new workflows into your day-to-day operations.
Updating your MPP and consent workflows isn't just about checking a box. It's about building a privacy program that can withstand OCR scrutiny and support coordinated care without compromising patient trust.
At North Country Communications, we help practices move from awareness to action. Whether you need a readiness assessment, updated workflows, or scenario-based team training, we build solutions to fit the way your organization actually operates. You can reach us at 877 North 20 or at info@northcountrycommunications.com for a free confidential consultation.